It's just now 2 o'clock. We're going to give it just another minute here before we get started. If you can hear me, go ahead and just type yes in that Q&A box for me so I know. Thank you. Good to see everybody. All right, I think we're ready to go, Zach. Let's go ahead and next slide and we'll get started. All right, Zach, if you want to go ahead and advance to the next slide, we'll go ahead and get started. All right, here we go. All right, thank you. Sorry about that. Welcome, hello, and welcome to the Association for Healthcare Food Service Washington Chapter webinar. My name is Mark Bennett, Media Chair for AHF and Market Team Food Service, Cambro Healthcare Specialist. I'll be facilitating today's webinar and look forward to your participation via the Q&A. Please note that this webinar will be recorded and all participation lines will be automatically muted during the broadcast. A copy of the recording will be available on the AHF website. You can participate by adding a question in the Q&A box and our panel members will respond. Please take advantage of this opportunity to engage with our panel of experts. All right, next slide. There we go. Today's webinar features a 4-person panel of AHF members: Zach Schwab, Corporate Executive Chef, Swedish Medical Center; John Pilgrim, VP of National Sales, U.S. Foods; Nancy Lambert, National Sales Manager, U.S. Foods; and Barb Peters, Account Executive, U.S. Foods. AHF would like to thank today's panel members for participating and providing their professional insights to the changes we are experiencing in today's market. For those of you joining us nationally, we would like to point out some of the information provided in the following slides applies directly to our Northwest markets. Today's featured presentations are in 2 parts. First, Zach Schwab will tell us how Swedish Medical Center has recently gone cashless. Then, U.S. Foods panel members John Pilgrim, Nancy Lambert, and Barb Peters will discuss supply chain challenges and solutions and ways to increase revenue in cafes. I will now turn things over to Zach Schwab at Swedish Medical Center to tell us more about how Swedish Hospital has gone cashless. First question for you, Zach. Was it the pandemic that started your investigation for going cashless, or were you looking into this already? And Zach, you are up, buddy. Can you hear me? Zach Schwab? Zach might be having some technical difficulties. And I apologize. Well, I think we'll wait for Zach to maybe try to get back on the call, and then I will go ahead and just forward on to the U.S. Foods portion. I apologize. Working through some issues, I think, on that side. Next, so transitioning now real quickly, apologize. Next,
I think I'm on mute.
Oh, are you now? Are you there, Zach? Zach Schwab?
Yep. Can you hear me now?
We got you now, Zach. Thank you.
Thank goodness. Sorry about that. It was like as soon as we went live, everything turned off on my.
It's cool. Oh, cool.
Yeah.
Because my ACT scores were.
No worries.
Can everyone else mute?
All right, let's get everyone on mute except for Zach Schwab.
Okay, I got muted. Now I'm unmuted. Okay, can everyone hear me?
Yes.
Okay, outstanding. Okay, so let's see here. Well, glad to be here. Sorry about the rough start there. That was very strange. How it tried to get me to, it just kind of disconnected me there. But so I'm here to talk about what Swedish Medical has done during COVID-19 and some of the solutions that we did. So COVID-19 came really quickly to the Northwest. We started looking for ways to slow down the spread of COVID-19. Some of those measures included like installing plexiglass barriers for our cashiers, special stickers on the floor to assist with social distancing. Thank you, Barb, for helping with that. Closing all the salad bars and all self-service. We also moved all of our tables and chairs so that no one would sit closer than 6 feet. I must have emailed Zach Cross, if he's here, a dozen times during those first initial weeks, trying to figure out what each campus was doing, because we were the first in the Northwest really to experience this. One measure that we took that seemed to get a lot of interest in, I know I had some other directors and whatnot calling us, was going cashless. The way that worked is we partnered up with Ready Credit Corporation. They offer their services in all of North America. They've been in business since 2006. They reached out to us in March offering their services and was able to quickly move us into position to stop all cash handling. We had lots of support from our leadership for doing this. It made things move really quick. We had a solution-oriented approach. We just kind of moved towards whatever we could do to stop the spread of COVID-19, and this is one of the solutions. Yeah, and it took us less than a month to make this transition. Next slide, please. Or am I sharing? Okay. So a little bit how this works. It's a very simple. I was surprised how simple this was. It's self-service. It takes about 20 seconds to a transaction to get cash out of or get a card out of the machine. It's instant funds on a prepaid card. It's not like a gift card. If everyone bought a gift card before, you got to register it and do all that stuff. You don't have to do it with this card. You can just immediately put the money in, and then the card spits out. If the customer has an issue, it takes about 25 seconds to get on the phone with someone. There's no fees for the customers, and and the funds can be used off-site too. So once someone puts in their cash, they get a prepaid card that can be used anywhere. Next slide.
You've got control of the computer.
Okay, cool. All right. So why did we go with cashless options? One of the reasons is, like I mentioned earlier, less risk of transferring pathogens. Another reason, we found out that it reduced our cost by a lot, because no longer did we have to count cash in the cash room or balance tills at the end of the day. In patient services, we collect cash for orders upstairs. Productivity went up there. In fact, our Press Ganey scores improved in that month. I'm not saying that was the whole reason why, because the initiatives going on, but that was really enlightening, because each nutrition assistant spends about 15 minutes at the beginning of the shift and sometimes 15 minutes after their shift to go through with that. So that was kind of an extra bonus. Transactions are faster. There's no more making change. So people come with their card. Depends how fast your card readers are, but if it's fast, like at like some of the grocery stores have it, then it'll be done really quick. And the nicest thing that I like is no more counting safes. That was a huge endeavor, you know, if someone has to go in and counting it, making change and ordering all that stuff. Some of the services they offer is basically they bring in an armored carrier to do all the cash handling. So you never touch the cash, you never touch the cards. There's on-site maintenance. So if it breaks down, they come in and they know it's broken before you even do, because the signal goes out, there's an issue. And that's about it for so what I have on these machines. We just got them. We love them, and we're considering keeping them on even after COVID-19. There is a charge to use these machines per machines, and that's kind of based off how many transactions you anticipate. So at our hospital, it's really big, so we can have a lot more transactions than another. And yeah, so that's how that works.
Do we have any questions from people out there on Zach's presentation and on going cashless? Zach, we got one for you here. How have the machines been received by the public?
So at first, it was a little bit confusion, but it's so simple because it's a smart machine. It's just like a tablet. The display is you put in the cash, you put the button how much you put it in, and it spits out a card. It's that easy. It doesn't take your information or anything like that. And they understand that we're trying to stop the spread of COVID-19. So it's been received pretty well.
Are you seeing people using maybe a glove when they go and touch and use that, or is it fairly touchless?
It's a touch screen.
Touch screen, yeah.
And we do sanitize it. It's right. We have it placed right by our registers. It has a really small footprint. It's like 2 feet by 2 feet. You just need an outlet and a cell signal, and it operates just like that. And the outlet it doesn't take many amps at all. It's like 15 or something.
And do you have experience maybe reusing these cards at other locations?
So you cannot recharge them. It's a one-time deal. Here's an example that people might find interesting. So if let's say someone put $20 on their card and they spend $15 today, and tomorrow they spend $15, they'll be able to use the last $5 first, and then they can use the rest of then they'll have to use another card. So we're able to split transactions in situations like that. Yeah.
How many machines do you have on campus?
First Hill, we have 2, one in the lobby and one in our cafe, and that's handled all the volume. And we don't have much volume right now because of COVID-19, but that's how we handle it.
Great. And a question, do they use a credit card machine to pay, and can it be left unattended?
It can be left unattended. It can just sit there in the lobby unattended. And you can't put a credit card in there to get another credit card out. You have to put cash in to get a card out, if that's what they're asking.
Yep, cash in for card out. Okay.
Yep.
Right. Another question, is that a replacement of paying with staff card?
No, we still have gym pay. So people still can load their gym pay with a credit card, but they can't load it with cash. So if someone wanted to load, we call it gym pay over here, when people load funds onto their badge. So if they have cash that they would load onto it, they'd first have to go to that machine, and you can load it up to $500, and then they can do the transaction into it.
So when they use the card in your cafe, do they just come up to the cashier, they swipe it, and they're taken care of? Balance is kept?
That's it.
Great.
Yes, it's very simple. I really like it. It seems to go quick, and the lines go quicker. The lines aren't as long because people aren't digging through their wallet or their purse for cash or for that one penny to get exact change,
Yeah.
Yeah.
Well, thank you, Zach. That was great information for operators looking to reduce touch points in their cafes, and that can make things safer for everyone. And also, like you said, you don't have to count down the safe at night. So that sounds good too.
Yep. All right. Thank you.
All right. Well, now we're going to transition to the second part of our presentation. And Zach, if you can go to the next slide for me.
Yep.
Great. This is going to be led by John Pilgrim, Nancy Lambert, and Barb Peters at US Foods. And joining them, I believe on the line is Zach Cross from UW Medical Center's Plaza Cafe. They're going to be covering the safety standards that distribution centers are following to keep everyone safe, supply chain challenges and how US Foods is adjusting to new demands, and ways hospital cafes can increase revenue. I will now turn things over to US Foods, and please tell us, how are you guys meeting the needs of your customers during these challenging times?
Hey, so good afternoon, everyone. This is John Pilgrim, and thanks for giving us an opportunity to join your meeting today. Very excited for be able to maybe share and learn from this day. So obviously, the entire food service industry was impacted as the rest of the world with the pandemic. And from a food service supply chain standpoint, we too all had to take a significant pivot there here in the state of Washington in early and mid-March as we watched our senior living facilities and nursing homes get overwhelmed with the virus, and many of them going quickly into lockdown even before the state was starting to lock down. And that changed a lot for what we had to do to service our customers. There were in nursing homes, for example, and in assisted livings, they went from dining room service to meals were being delivered to those residents' bedrooms, into their apartments from that standpoint. And then they went, from there, even going off the plate and being delivered via, styrofoam containers or paper containers, so that items can be immediately disposed of, which obviously then brought a draw on supply chain with that inventory, with a quick move of going away from plates to disposables. And then as we continue down to lockdown and restaurants closing down, it put a strain on the entire distribution and manufacturing industry, when all that food service needs was pretty much 80% stopped from being purchased. Many POs across the country were locked down and or closed or canceled, so that the distributors weren't going to be overwhelmed with inventories, even though they were. It's going to be the inventories of the wrong items that our customers needed. So as we adjusted to this environment, it was leaning in with our customers, our GPO partners, and our distribution partner or redistribution partners, to ensure that we're getting the right items for what our customers needed to get through these times, and to make those adjustments. And that took some time, because an average lead time on a manufacturer to a distributor could be anywhere from 7 days to 21 days. And when you had the manufacturer behind in their manufacture of those goods, or the supplies they need to manufacture those goods, you're now talking 30, 45 days before a product can get from point A to point B into a distributor before then making it to the customer. So, what we're seeing now today is that it's starting to balance out. Many markets across the country are starting to open up, and demand is slowly increasing. Meanwhile, here at US Foods, we about 3 weeks ago started increasing our inventory levels, or at least those purchase orders of those inventory levels, to get us to the point where we're ready to prepare to service our customers as they open up for additional pieces of business. Here up on the screen is just a splash page from our US Foods website, we're about food, and it always has to be great food, no matter where your industry's, in the hospital, nursing home, or assisted living, or even rehab. It's just making sure that your customers and your clients are getting that great food, helping you with your business, and how US Foods can help you make that. Do I have control of the deck? No. Can you go to the next slide, please?
Just say next slide, and I'll move
there
over.
There we go. Great. So just from a standpoint, let's talk about safety. And this here states about Texas Tech closing down, as many of our customers closed down all the way or partial during the beginning of the COVID. But it started with safety, and US Foods is definitely very proud of our safety record. And we start off with with safety discussions before, during, and after every shift. And we're very proud that we had minimal, less than 1% of any of our employees that were impacted by the COVID. We had no warehouse issues with COVID, and no transportation issues with COVID, because we brought safety to the forefront, making sure social distancing, the right equipment from gloves to masks, or with our employees continuing sanitizing not only office spaces, but more so the warehouse, doubling down on ensuring that the warehouses and the tractors and trailers and the drivers had all the appropriate equipment and sanitation needs. Zach talked earlier about going cashless. Us too. US Foods. One thing is making sure that we moved away from our drivers picking up checks or cash upon receipt with the customers, because we know that could just add another opportunity to get someone infected there. So we took that piece away too. We worked with many of our customers on how we can make a more safer delivery to their location, for not only for their employees, but also for our driver who might be moving on to 4, 5, 6 more customers after that. So safety was always from the get-go forefront for us. Next slide. So further on our website then is how do we help our customers and support them? And this is this splash page to the US Foods website. Even if you're not a US Foods customer today, you still can go on to usfoods.com and be able to see a lot of this information sharing with everyone today. And I like to point out is one way we're trying to help our customers is by, on a weekly basis, we have anywhere from 4 to 6 webinars available for our customers to join and learn about things everywhere from how can they navigate the CARES Act, when you think about some of those independent restaurateurs and independent operators, from cash flow. How can they accelerate takeout? How can they utilize social messaging on letting their customers know what they're doing? Additionally, how can they open up safely now that we're getting closer to a reopening phase? What does opening up safely look like? What supplies do they need? What's that checklist look like? And these webinars, many of these webinars touch those bases. So if you're ever interested, looking for additional learnings or feedback, feel free to look into that website, take a look if there's a webinar taking place in your area and at your particular time. And then we have an entire business solutions team that's bringing innovative ideas to, again, how we can help our customers get through these challenging times and how everything's evolving here, from anywhere from meal kits, to taking a retail outlet and making them almost a grocery store out of it, and even other new business channels, which we saw a lot of customers adapt, and how they can be able to drive additional revenue and also help get rid of some aged inventory themselves. Next slide. And then we help lead a campaign with a lot of our healthcare customers with how they can recognize maybe some of their own heroes from that standpoint. We know many of the employees at a healthcare facility are working long, tiring hours, and what we found is a lot of our customers are worried about them after working those long hours, and then they're driving to either a takeout place to get food or trying to go to a grocery store and get in line, and just adding to the possibility of contamination, through another channel. And fair amount of facilities, both assisted living and hospitals, took advantage of creating employee grocery store where employees can be able to grab some everyday essentials from food and non-food items to be able to take home, to buy and be able to take home with them. From meal kits that they could be able to take home. One healthcare system had a meal box where it can feed a family of 4 for the week, and it was at a very reasonable price of items in there that they can go be able to put in their fridge, and then they'll cook some meats. They'll have some pasta, the canned goods, and some fresh items that they can be able to put the meals and help, again, put their employees in a safe spot that they're going directly from work to home. Next slide. I mentioned earlier about our business solutions team. So we have a business solutions team that's been working on how do we help our customers move to that next phase here of reopening. When you think about a hospital that maybe their cafeteria's been shut down for quite some time and now ready to open, what does that now look like to ensure that those visitors, those employees are in a safe spot? And US Foods has made a huge investment in the items, one, when they're ready to reopen, from hand sanitizers, thermometers, masks, but then also what's the rest of that look like? Because we know, for example, you're not going to have ketchup and mustard and mayonnaise on the tables. You might not even have salt and pepper on the tables. So we've done significant investments in PCs in those condiment areas, and having that list so as our customers are ready to reopen an area of their facility, that they know what they need to buy or what they're going to need to have a successful launch of that. And then signage for their operation, for their employees and for their customers and their visitors to their facilities from social distancing, making sure it's staying clean and staying safe, or even open signs. Next slide. So again, another way we're navigating the pandemic, I mentioned before of our warehouses and the challenges of getting out some of that excess inventory we're sitting on because no longer customers were buying those fresh meats. Many protein items ended up going in the freezer because the restaurants weren't buying it. So many of those restaurant normal items that would be selling, we ended up being overloaded there. So we made significant investments, one, in helping out some charitable organizations such as food banks, and two, bringing those ideas as far as a grocery restaurant, at a hospital, at a restaurant, even at some hotels that were still operating in small downtown marketplaces, and then realigning ourselves with the inventory that was needed to take care of our customers today. Next slide. And now we're hearing a lot in the news the last couple of weeks about the meat supply and shortages out there. And this is definitely one that's very volatile because all it takes is another, COVID incident that happens at a facility and shuts that down. And then next thing you know, you're talking about whether it be pork or poultry or beef. And that's, that warehouse, what they could be possibly producing on a daily, weekly basis could end up moving that particular category 10, 15, 25% behind schedule that's getting out to the marketplace, whether it be retail or food service. So while we're seeing that, we're all trying to make some investments on what can we carry a little bit more in the freezer to have that backup. But then also, I would encourage everyone to work closely with their suppliers to understand what is available as you're preparing your menus. And are you making your menus on a weekly basis versus a monthly basis, because there could still be some challenges over the next 4, 6, or 8 weeks. Next slide. And then reinventing dining. So this is an example with our team that did a process at Texas Tech as they're preparing to reopen, but aligning. So I talked about the available assortment. Please make sure you're partnering up with your distributor to understand what the assortment is and what are the quote unquote risk items that maybe has a tight supply chain. last 2 weeks, probably many of you seen that yogurt's been a challenge just because of what's happened in the retail side, that the yogurt companies haven't been able to keep up with that demand, and then it ends up impacting the food service distribution side of that business. So definitely recommend always having great communication with your distribution partner. And next slide. So that's our talking points, but we'll be glad to take any questions.
Zach, if you could just move back one slide for me. Perfect. Perfect. I just want to jump in. Zach Cross, are you on the call? And could we get you to include some ways that Plaza Cafe has made changes in the past couple months?
Hello, everybody. I'm here. Can y'all hear me?
We gotcha.
All right. So some of the things we've done at the Plaza Cafe have been addressed a little bit. The biggest focus that we pushed on was that throughput. I think we had the same focus as Zach, and we went about it a little bit differently. We really focused on getting our stuff boxed up and grab and go style and ready to go. So where it used to be that customers would come into the cafe and walk up to the different stations and order their food, we just started pre-packaging everything. So we got it into boxes, we got them onto hot plates or into steam wells, but in the box. And then the other big thing that we focused on was getting everything barcoded. So now in the cafe, every single item has a barcode button. And the goal with that was, again, that either touching things from people, right? So taking the can of Coke from people, now everything has a barcode and we can just get them to spin it around and we just point our scanners at it and we scan everything. And so it's made it faster for the cashiers because they no longer have to ask, what did you get? Did you add cheese? That whole part of the conversation has gone away. And the customer just walks up, there's a barcode on the plate or on the box and we scan it. And so I know from the data collection side of it that the customers are getting, as long as the barcode's right, the customers are getting are paying for what they got. So it's made it more accurate for us and it's made it easier for me to track our inventory through our system. So that was one of the biggest focuses that we had. And we've been looking into some other things now, like that whole grab and go C-store or grocery store type item that I know a lot of other hospitals have implemented. We haven't caught up with that yet, but that's been our big push, has been barcoding, trying to get the customers through the cafe faster, to limiting the exposure time for our employees.
Thanks, Zach. We're getting some questions in here. How did you get barcodes on everything?
So we have a program suite called Bartender. That's a labeling software. And that's something that we've been using. We've been using that for quite a long time on our grab and go items. So it was a 2-component process. We have a cash register system called Volante. That's our point of sale system. And so through Volante, we can generate barcodes. So through Volante, I created every menu item that we sell, every single thing that can get rang up at the register. And then I generated a barcode from Volante. And then I put that into our recipe database, Seaboard. And so then all those items, when I want to print off the labels, all that information is there. Bartender can generate the image, that barcode image that the items need. So that's how we did it. We used Bartender along with Seaboard for that 2-step process.
That's great. Any other questions on barcodes? We're getting some more out here and just good general questions. This would be both for Zach Schwab and Zach Cross and others. Do you guys have any ideas on how to encourage social distancing in cafes, not dining areas? We're struggling with how we will crowd control as our volumes increase, particularly during the lunch rush. How are you guys approaching that? And maybe from US Foods as well, what items do you have that can help a operator?
Barb, you want to take that?
So this is Zach from UWMC, and I'll just speak a little bit. My goal has been that throughput in the cafe to try to limit the options. I'm working on a couple different things that aren't ready yet because they're bigger ticket projects, but I'm working on some things like order kiosks And my goal with order kiosks is currently in our cafe, well, pre-COVID in our cafe, customers would fill out a piece of paper and put it in a basket and the staff would grab it. And now with COVID, we know we can't do that anymore. So we're working on order kiosks as one way to limit interactions between customers and staff. But how that ties into speed is that the goal is once we get live with order kiosks, we'll have ticket printers in every station. And now people would be able to, through Volante, and I'm sure other point of sale systems have the same thing, but we can set up an online web page for our cash register system where people would be able to sit in their desk at their office and they'd be able to place their order online, and those orders would come out to the printers in the stations. The employees would be able to put those orders together, have them ready, and then the customer can walk into the cafe, grab that order, it's got its barcode, they walk up to the register, scan the barcode, brings up the transaction, pay for it, and out the door. So for me, that's been my biggest focus of how we can stream up and prevent congregating in the cafe is through that online ordering. And we've also talked about the idea of delivering to the nurses' units, which is a very far out there idea. We have to get the online ordering component first, but that's something that we've been working hard to try to implement so that way when we do start seeing big volumes again, hopefully those volumes are able to order before they come in, walk in, grab their food, walk out.
Excellent. And Barb, can you touch on some available items that would encourage social distancing that you're offering?
Absolutely. So thank you again for having us. US Foods has invested in floor decals, social distancing signs, and some other COVID resources. Some of that is found on your website, but definitely your US Foods rep can help you get to those, and Gina, I will make sure to send that out again to you.
Excellent. More questions. Zach, what changes have been made to your patient delivery meals? And that would go for either Zach.
So again, for our patient meals, our volumes dipped a little bit during that period where we were really nervous about everything. Our patient volumes dipped. In the very beginning of the pandemic, we restricted visitor access. And so we saw the cafe side really drop. But when we were still allowing one guest per room, we were doing guest trays through room service. So room service was picking up a little bit more volume. So we saw a slight drop in volume of patient trays, but some of that volume was offset by guest trays in those patient rooms. And we ran that program throughout the most severe part of the pandemic, and we're continuing to run now, but our patient volumes have returned to their absolute normal volume. So we are right back to our pre-COVID volumes and a little bit more because of our guest trays. We're still running those. So our patient volumes things really haven't changed on the patient side of it.
Another question for you, Zach. Are your order kiosks through your POS provider?
Yes, so we got our order kiosk through Volante. So we've purchased those. We don't have them implemented, but it was all through Volante, which makes it really easy because it ties all the systems together. And Volante is capable of doing the whole online ordering portal also when we get to that stage. So they can do it all for us.
Excellent. And Zach, how do you have guests pay for their guest trays?
So our guest trays, after this meeting and learning about this cashless system, I'm going to take this back to my administrators and work on getting that in here for the cafes too. But currently we are doing, we haven't done cash for guest trays for years. So we either take the payment over the phone and we use Converge software, or we have the Converge software and we'll take that up to the room and it get credit card payment then. So we haven't been doing cash for a long time. So we use Converge software. That's independent of our point of sale system. It's a standalone thing. So we have to reconcile those receipts separate from our point of sale, but it's a pretty simple system to use also. And it limits that exposure risk.
Have you changed many of your trays to single use?
We did for COVID positive patients, we switched to single use trays. In the cafe, we switched to all single use trays. But as the pandemic has progressed, we're comfortable with the washing of all those wares. And so we are using reusable trays again in the cafe, and we're using reusable trays. We do temperature checks on our dish machine at every meal period, so we know that the machine is meeting at least a 185 rinse. So we know that the trays and everything that we run through the machine is being sanitized appropriately. So we are using normal trays for some. For COVID positive patients, we are using single-use trays still.
Mm-hmm. Mm-hmm. Great. Open question to operators. Are you all making arrangements to reopen to normal operations in parallel with the governor phase 1 through 4 plans? For example, is customer self-service returning for you as shown in phase 3 or 4? Or do you think some of these changes will be permanent? And that could be for Zach Schwab or Zach Cross.
So I foresee that these changes aren't going back. I think that the public is going to be squeamish with a lot of these things. And I just think that in a hospital setting, I think there's other businesses in town that will go back to self-serve. We actually got rid of our self-serve salad bar more than, I think it's been about 10 years since we got rid of our self-serve salad bar because of this cross-contamination risk. So the UW Medical Center won't be going back to self-serve after this pandemic is over. Mm-hmm. And so other operators can make that decision, and I think that it would be, and from my personal opinion, it would be acceptable if other operators do go back to self-serve. But I know UW-MC, we won't be going back to self-serve in our cafe. We'll continue to pre-package bagels and donuts and those types of things, and we'll continue to keep those things where we'll dish them out. We'll have to figure out the labor aspect of that, but I don't think my administrators would be comfortable with us going back.
Do you think you'll keep your meals to go and the demand will still be there?
Yeah, I think the customers are appreciating that speed of service. It's sped up the lines. It takes them less time. And that was something that we've always struggled with here as our cafe gets incredibly busy during the rush. And so having those meals in a box ready to go, we'll still have the options. Right now, we've limited it to just the predefined meals. So that's an entree, a starch, and a vegetable. And once we get back into a more normal, whatever that looks like, service, I believe we'll portion up vegetables and things aside so people can come in and have a little bit more flexibility with what they get. But it is a service that I would like to maintain because it speeds up the line. It's more accurate for sales. I foresee that we will continue to do that stuff. And we're looking at launching some new programs like cooking the food, blast chilling it, packaging it up, and then putting it in our cold cases so people can come and grab food now and warm it up whenever they're available to eat it. Because that's always been a challenge for us too, is just the time it can take to get to our cafe, through our cafe, sit down and eat. Nurses and employees can spend their entire break just trying to get through the process of our cafe because it's so busy. So I think we will continue to try to provide those as a service for the customers to keep things fast for them.
That's great. I appreciate the input. Do we have any other questions for Zach Schwab or Zach, or any other input from US Foods or anyone else? Great. Well, just to wrap things up, we just want to say thank you again for the panel members for participating. I think we had a great presentation. Sorry about those little technical difficulties at the beginning. Please join us at our next AHF meeting, June 25th, where we're going to focus on the topic of disaster preparedness. The last slide that you're looking at now is a list of resources. We'd like to close with just an important message from AHF. It's no secret that the COVID pandemic has caused operational changes, resulting in layoffs. We recognize the hardships many of you are going through at home and in personal lives as a result. We've copied a list of resources from Big Table, which is a local nonprofit supporting food service staff. And this is a great list of resources for any individual. We're going to make this information available on social media so you can share and reach out. So thank you for attending, everyone, and have a great rest of your day, and stay safe out there.